OK, let's discuss this further. And with me are the political commentator Claire Pearsal and Dr. Bharat Pankhania, who is a senior clinical lecturer at the University of Exeter's Medical School. Thanks to both of you for joining us on the programme this evening. Dr. Bharat, if I can start with you. In hindsight, the science screwed up, didn't it?
I don't think it is hindsight, because people like myself were alerting people who would listen about the dangers of not doing anything, the dangers of not bringing in early control measures. I don't think you need to say, I prepared for a specific virus and therefore I knew what to do. And because I didn't prepare for a specific virus, I didn't know what to do. We know what viruses do, and we know that you take control, and you take control by bringing in restrictions on movements, and you do test and trace and containment. We didn't do any of those things properly. And therefore, it isn't a case of I would have done it better if I had hindsight. These are empirical measures that you could have done, and you could have done better.
Yeah, Claire, is this a total failure by the Prime Minister Boris Johnson, presiding over the biggest public health failure, and it cost thousands of lives?
I think it's unfair to say it's a total failure. I think that early mistakes were made, and we can all see that. We look at how care home residents were left to their own devices, the staff were not tested, they did not have enough PPE, and those processes of discharging patients from hospital without being tested were appalling. Community testing, or the lack of community testing, is also a very large problem. But I also think that it highlights that governments across the world must have a pandemic preparedness programme in place. We were running off of a plan which looked at flu and how flu works. Now, we can see that COVID is different. Viruses may work the same, and I'm not an epidemiologist, a virologist, but this one did act differently. We should have shut down sooner, but I think it's unfair to say that it's entirely the Prime Minister's fault. We didn't know what
OK, but other countries were doing it successfully. Taiwan, South Korea, Italy, France, they all locked down earlier than the UK. And we were watching this viral tsunami roll across the globe, and yet our government did nothing.
And I do agree with that. I agree, and said at the time that we needed to shut borders. That is the one thing that I learned from the Home Office, is that you can shut your borders and you can do it quite quickly. So why we didn't do that is beyond me.
Dr. Bharat, is it your understanding that perhaps the UK government was trying to attain or pursue a herd immunity approach in the UK until it became clear that the public health system would collapse?
Well, we were worried and we were shocked and we were very concerned that what appears to be in progress is a herd immunity approach, as well as conversations by Prime Minister Johnson, words to the effect on television, take it on the chin and get on with it. I've gone around shaking hands with everyone. All of those things indicate to me that there was a low-key approach to containment and management of this infectious disease. And then it was only later on, when hospital beds started to fill up and people on respirators and seriously ill, that control measures were eventually put in. And just to sort of counteract what my colleague has said about this was SARS-CoV-2 and not influenza, and we were dealing with influenza, I repeat, if you go back to empirical first principles, then the principles of containment, be it SARS, be it MERS, be it influenza, are similar and almost the same. So I feel it is disingenuous for people to say, we didn't know it was going to be SARS-CoV-2, therefore I have got a get out of jail card. You know what to do on first principles, and you could have done it. People like myself were saying we should do it in such and such way. It wasn't done.
Claire, you're shaking your head there, but the government's own advisor, Dominic Cummings, said this was a government not fit for purpose.
Well, I think Dominic Cummings does have his own agenda somewhat, seeing he has now left the employ of the government. I do question what the scientific advisors were doing and why were they not pushing the message harder. Now, it could be that the advisors were advising and ministers deciding, and I think that's what we need to look at with a future public inquiry. But until that date, I don't think you can just say it's not fit for purpose when the vaccine programme has come along and has been an unmitigated success.
Yes, Dr. Barrett, apologies, the vaccine rollout was praised in this report, and that has been a huge success, hasn't it?
Yeah, but let me add to this. So we have existing infrastructure. The United Kingdom invests heavily in pandemic preparedness, emergency resilience forums. Furthermore, it has a local authority environmental health officers, it has its Public Health England workforce, it has genitourinary medicine clinicians and others. None of them were used in the context of test, trace and contain. And the government went about setting up its own new, in the middle of a pandemic, test and trace system, which never worked efficiently. And then coming back to the vaccines issue, that was given to the GPs to deliver, the GPs who've always delivered the seasonal influenza vaccine program, for example, and they delivered it brilliantly. They did it at low cost and extremely well. So the credit goes to the GPs, and if only the GPs and existing National Health Service, Public Health England and local authority resources had been used, we would have been in a much better place. Why didn't we use all those resources that we pay for?
Yeah, I mean, Claire, what are your thoughts now? Are you confident that this government now has a strategy in place to deal with future crises, future pandemics?
I would sincerely hope so, and this is the job of the government going forward to put those in place. And I do agree with what's just been said, that local authorities were severely underused during this process. Now, I know from my own local authority in Kent how best placed they are to get help to people, to look after communities, to understand rollout of test and trace and testing capacities, and they weren't used. And I think that was a real vital mistake. Local authorities are so much better placed than central government in these instances. And I really wish that going forward, local authorities were given much more of a hand in the public health messaging going out and the work that's being done in community.
Dr. Barrett, going forward, cases are still high here, daily cases 30,000 in the UK, challenges obviously still remaining. What lessons can we learn from this, and what do you think are the biggest challenges that still lie ahead?
Well, we need a body. So we've now got the Public Health England disbanded, and we've got the UK Health Security Agency, or what's to that effect. And we need them to be slightly at an arm's length from government. The Public Health England during this pandemic was hardly seen or heard of. Its chief executive officer was hardly ever seen during the biggest pandemic ever. So what we want is an independent advisory body that is very visible and acts in the interest of the nation and isn't lent upon by ministers and ministerial agendas. So we really need that, so that we know that when the scientists say we need to do X, Y, and Z, it is done rather than watered down because of ministerial desires or preferences.
OK, Claire, before you go, Boris Johnson's former Health Secretary, Matt Hancock, despite being complicit, some might say, in this public health failure, has just been given a plum job with the UN. What are your thoughts on this?
This is quite an interesting appointment, and whatever your feelings on Matt Hancock and his previous behaviour, we have to understand he does have a lot of knowledge now of pandemic planning, be it right or wrong. And as I say, whether you disagree or not, I think he can bring some strengths over into Africa to look at the recovery economically, certainly from COVID. And it'll be interesting to see how that plays out. He is a very versatile politician, and I'm sure he'll turn his hand to this.
I think it might prove to be a controversial appointment, but we'll save that discussion for another day. I want to thank both of our guests, the political commentator Claire Pearsal and Dr. Bharat Pankhania. Thanks to you both.